want to pay for other people's health care, my brother in Christ. That's what insurance is. That's what it is. You pay money for other people's health care. That's how insurance works. Oh my God.
Question. Why does it matter so much that immigrants are getting health care again? What is the end goal of that? So if they get taken off the health care, that means more health care for us? Like there was a shortage on health care? Is it because our deficit's really, really high? Even more high because the billionaires got their tax cuts?
You know, the big beautiful bill will kick 17 million people off of Medicaid and Medicare, right? Yeah, but it's only illegal immigrants. Illegal immigrants don't receive Medicare or Medicaid, at least not from the federal government in the way that citizens get Medicaid. They only get it for emergencies, like if they're actively dying at the hospital. But there's all these able-bodied young men who aren't working and are just sitting there collecting Medicaid checks. You don't collect Medicaid checks. That's not how it works. You go to the doctor and you pay for that with Medicaid.
Insurance premiums just doubled across America. Medicaid cut for 17 million people. Healthcare subsidies gone, clinics shutting down, and the people screaming the loudest? MAGA supporters who voted for every single one of these policies. I don't want socialism, they said, while cashing government healthcare checks. Repeal Obamacare, they cheered, not realizing it's the same as the Affordable Care Act. I shouldn't pay for other people's health care, not understanding that's literally what insurance is, where MAGA's promises met reality and the bill finally came due. People are in shock. But this isn't tragedy. This is arithmetic. Welcome back to Mind Mirror. Let's break it down.
You don't collect checks. So the only people that are using Medicaid are the people that are sick and need to go to the doctor. Well, I just don't think that I should be paying for other people to go to the doctor. I think that they should get a job and work hard enough so that they can be able to afford it themselves. But this bill will affect single mothers who are trying to work 2 or 3 jobs to pay for their kids to go to the doctor. You don't want their kids to go to the doctor? If a mom isn't wealthy enough to have a kid, then she shouldn't have had a kid in the first place. But y'all made abortion illegal.
Wait, so poor women shouldn't have kids they can't afford? But abortion is illegal, and then you cut Medicaid so those kids can't see a doctor? That's not policy, that's a trap. You've literally banned every exit. Here's what actually happens. When kids don't get health care, they develop chronic conditions, fall behind in school, end up in emergency rooms, which cost taxpayers way more than preventive care ever would. You didn't save money, you just made the problem more expensive and more cruel. Congratulations.
Yo, what's going on, guys? So Donald Trump is just getting crazier. Apparently, he shut off Medicaid. As you can see here, it's trending all over X because this is affecting millions of Americans. For those of you that don't know, Medicaid is a government program for people with low income. It helps them with healthcare. So, medicine, doctor visits, hospital stays, even nursing homes will be affected. And a lot of these people won't be able to afford these things. And a lot of those people will actually be supporters of Trump. So pretty much he's saying he doesn't care about those low-income people. Really, he doesn't care if they die. And guess who he's given money to? The millionaires, right? The Jeff Bezos, the Elon Musk, the Zuckerbergs. So again, this is all about the rich getting richer. Trump bamboozled you.
Trump calls on Congress to enact the Great Healthcare Plan. Let's get into it. Trump's healthcare plan has 8 main points. Number 1 is to lower prescription drug prices using international price matching. The government will require drug companies to sell medication to Americans at the same low prices they charge in other developed countries. Americans get screwed when it comes to prices for medication. We pay far more than people abroad for the same drugs.
Okay, credit where it's due. International price matching would actually help. Insulin costs $10 in Canada, $300 here. Same drug, same company. It's highway robbery, and Americans have been getting fleeced for decades. But, and here's the catch, this only matters if people can afford insurance in the first place. You can lower drug prices all you want, but if someone just got kicked off Medicaid or their premium doubled, they still can't get to a doctor to receive that prescription. It's like handing someone a coupon after you burn down the store. Nice gesture, completely useless.
And this forces fair pricing and saves patients billions. Number 2 is cut insurance premiums by ending insurers' kickbacks. The plan bans hidden rebates and kickbacks that pharmacy benefit managers and insurers receive from drug marketers, which inflates costs and keeps premiums high. It removes these secret payments, forces lower drug prices and transparent pricing, and directly reduces what consumers pay for insurance premiums. Number 3, send money directly to people to buy their own coverage. This is how it will work. The plan replaces ACA subsidies that are paid to insurers with direct payments or credits sent to eligible individuals, who then use the money to purchase any healthcare insurance plan they choose. It gives consumers a real choice, cuts out insurer middlemen, empowers people to shop for better coverage, and promotes competition that can lower costs. Number 4 is to expand over-the-counter drug access to boost competition. The plan makes more prescription drugs available without a doctor's visit by switching them to over-the-counter status. It increases competition, lowers prices through easier access and more options, reduces doctors' visits and costs, and gives consumers faster, cheaper relief for common conditions. Number 5 is to force hospitals and insurers to post clear prices. The plan requires hospitals and insurers to publicly disclose all prices for services and procedures up front in a clear, standardized way. This ends hidden pricing, lets consumers shop and compare cost, increases competition, and drives down prices through transparency. Number 6 is to make sure insurers disclose denial rates and profit margins. This plan requires insurance companies to publicly report their claim denial rates and profit margins. It exposes unfair denials and excessive profits, increases accountability, helps consumers choose better insurers, and pressures companies to approve more claims and lower costs through transparency. Number 7 is to crack down on pharmacy middlemen inflating costs. The plan targets pharmacy benefit managers with stricter regulation to stop them from inflating drug prices through hidden fees, spread pricing, and rebates that don't reach patients. It eliminates excessive middlemen profits, forces more savings to flow directly to consumers and pharmacies, and lowers overall prescription drug costs. And last, number 8 is emphasizing consumer choice and market competition. The plan promotes free market principles by giving people direct money to shop for insurance, banning anti-competitive kickbacks, requiring price transparency, and removing barriers to over-the-counter drugs. More choice and real competition force insurance and providers to lower prices, improve quality, and offer better plans to win customers. I know that some of you are going to say, what the fuck? I understand that this is a different way to do insurance, but aren't each of these points everything we've been hating insurance companies for? Follow for more updates and tell me what you think in the comments.
Undocumented immigrants in the United States cannot receive health insurance from Obamacare, from Medicaid, from Medicare. They are barred from doing so. And if you tell me, oh, but I know my tia, I primo, they're doing that illegally. That is illegal, okay? And the Republicans, all of the maggots, are saying that Democrats didn't want to vote on the spending bill that would have kept the government open because they're dying on the hill of giving health care to illegals. No, the reason the government is shutting down is because the Democrats refused to join a vote on the spending bill that would keep the government open, or would reopen it at this point. Why? Because MAGA wants to gut healthcare in this country for millions of people, even more than they already have. So what happens now? Hundreds of thousands of people in this country are furloughed, right? Federal workers are furloughed, meaning they are given unpaid leave, and whenever the government ramps back up, they're going to come back to work. And aside from that, there are many other people who work in very essential jobs. For example, like air traffic control people. They are working right now with no pay. And they're going to have to wait until all of this is sorted out to be able to receive retroactive pay. So no, Democrats aren't to blame. We have a Republican-controlled House, Senate, Supreme Court, presidency. They are in full control of what is happening in this country right now. And if they don't want to solve these things, the least Democrats can do is do this as protest. Force them to come to the table to make concessions on these topics that need concessions to be made. I actually have a good example of how healthcare works with undocumented immigrants. Stick with me. An uncle of mine lived here in the US, in Miami specifically, for many, many years. And one day he had a really, really gruesome workplace accident. We thought he quite literally died, right? He fell off a roof. And it was so bad that when they called the ambulance, the Jackson helicopter from Jackson Memorial Hospital here in Miami, they came to pick him up and took him all the way to Ryder Trauma. They did emergency surgery on him. They stabilized him, all that. Thankfully, he's still alive, right? He's living in Honduras now. But the thing is, that's all, right? They only stabilize people who are undocumented here in the US. If they want to get more healthcare, more, attention, medical attention, they need to either pay out of pocket or be in some kind of life or death situation where an ambulance or a doctor is not going to be like, oh, wait, you're undocumented? Yeah, let me not save your life because you're an illegal. That's not how things work, at least for now, in the United States.
Finally, someone explaining the actual facts. Undocumented immigrants cannot get Medicaid or Medicare. It's illegal. Federal law explicitly bans them. The only exception, emergency stabilization. If you're dying, hospitals save you. That's IT. No follow-ups, no prescriptions, no ongoing care. And you know what's wild? Even that costs less than letting people die in the streets, because dead bodies create public health crises that cost everyone more. But it's easier to blame immigrants than admit the real issue. Corporate greed, insurance companies denying claims, and politicians cutting healthcare to fund tax breaks for billionaires. You got played, and your premiums prove it.
So yeah, if you are directly or indirectly affected, which I think we all are, by a government shutdown, you know who to blame. It's MAGA, it's Trump, and it's the Republican Party.
Full control. House, Senate, Supreme Court, presidency. And yet somehow, when the government shuts down, when healthcare collapses, when people lose coverage, it's still everyone else's fault? Nah. Federal workers are furloughed without pay. Air traffic controllers are working for free. And why? Because one side refused to keep subsidies that make healthcare affordable. Meanwhile, billionaires just got another tax cut. So yeah, when you're wondering why your situation is getting worse, follow the money. It didn't disappear, it just went up.
Florida FAFO, F around and find out. Affordable Care Act premiums have doubled in Florida as we speak. It varies again by your age, by your group, by your plan, by your family members. But in general, headlines across Florida, the prices have doubled across Florida. Well, you know what? Donald Trump told you they were going to make these changes. And who did you vote for? MAGA. You voted for Donald Trump. So I don't want to hear you all complaining that they've now done this. Now, do I think it's a right thing or a wrong thing? I think it's a wrong thing to have done, but they told you they were going to do this. This is in Donald Trump's big, beautiful bill. Donald Trump and the Republicans are the ones that are taking away your subsidies to help lower your insurance costs. They don't care whether your family has insurance or not. Now, if you're rich, they're going to worry about you getting your benefits. They're going to worry about you being taken care of. For example, Elon Musk has received $38 billion of tax credits, tax advantages, and other contracts, etc., from the federal government. You can go through a number of other companies and find they've gotten millions and billions of money back from the government. And yet, who's the one that's being bad? You are, for wanting to get those health insurance subsidies. And, well, that's who you voted for. What can I say? Love to hear from my Floridians, my Democrats, my MAGAs, my crazies, my cuckoos, and my burner light bulbs. If you're on the ACA in Florida, which there are 4.7 million, I think Florida leads the country with people on it. What happened to your premiums? They doubled, didn't they?
Florida, 4.7 million people on the ACA, more than any other state, and a whole lot of them just watched their premiums double overnight. Not increase slightly, not go up a bit, double. And here's the kicker. Red states use the ACA the most. Kentucky, Arkansas, West Virginia, Florida, these places depend on those subsidies, but they voted to kill them anyway. It's economic suicide in real time. And now people are staring at their bills like, how did this happen? You voted for it, Karen. You literally wore the hat.
For any Republicans out there or people who voted for Trump, if you are under the illusion that the Democrats caused the government to shut down, let me just change your mind right here and now. The Republican leadership, especially Mike Johnson and all of them, they're looking into the camera and they're literally lying to you. The only reason the Democrats are not agreeing to this budget bill is Affordable Care Act rates will go up at the end of December. Guaranteed. Affordable Care Act is the same thing as Obamacare. And did you know that the greatest number of states that rely on Obamacare are red states? So all of the red states, all of the United States, who are using the Affordable Care Act and getting subsidies, your rates are going to go up like 300-something%. It's not a joke. Don't listen to the naysayers. Do research. Don't listen to me. Go to Google. Just start researching it. Call your insurance company. Pick up that invoice, that bill that you get, and ask them what's going to happen. You've already received notices from them warning you. This is why the government is still closed and not reopening. The Democrats don't want to vote for it because then when your insurance goes up, you're going to blame the Democrats. So stop it. The Republicans have to agree to what the Democrats want, which is do not let the subsidies for the Affordable Care Act lapse. Keep them going, and our insurance will be affordable. That's why they call it the Affordable Care Act.
This right here is key. Democrats aren't blocking the budget to be difficult. They're blocking it because it lets ACA subsidies expire, which means insurance becomes unaffordable for millions. And when that happens, guess what the narrative will be? See, government healthcare doesn't work. No, you sabotaged it on purpose. It's like slashing someone's tires and then saying cars are unreliable. The ACA was working, premiums were stable, people had coverage, but it's been under attack for a decade. And now the people who cheered for that attack, they're the ones paying the price.
I see that there are multiple. 106. I heard 1. Thank you. I heard 9. Okay, let me transfer you to a live aid. How may I help you?
I'm a disabled adult. I am on SSI. I moved states from Colorado to Texas last month. I've been trying to get on Medicaid, and my case has been declined, and it's now saying that I might have until October 27th to review my case, but I urgently need medication that costs me thousands of dollars. I don't know what to do.
Okay, and it's for SSI, correct?
Yes, I am on SSI. I don't know why I've been denied.
If you do have a disability, let me go ahead and transfer you to a specialist who will be able to assist you. Do you have any other questions before I transfer you?
No, thank you.
How may I help you?
I am disabled. I'm an adult. I just moved last month from Colorado to Texas. I'm on SSI, but my first Medicaid application was denied, and I'm now being told that I have until October 27th to have my new application be reviewed. But I urgently need medication that costs $1,000 out of pocket, so I need some help here.
Once you do receive SSI, some clients are eligible for Medicaid because of the SSI. Thank you for calling HCA.
All right, thank you. Bye. Apparently I have to call Social Security. No one told me that, but that's fine. Because you can't even Google some of this stuff. Like, seriously.
Assistance with Medicare Part A, Part
Assistance
B, or
with
Part D, or
Medicaid.
how to apply for Medicare.
Assistance
help
with
you?
Medicaid.
Can you be a little more specific?
Assistance
Please
with
briefly
I
describe the
need
reason for your
assistance for
For
Medicaid.
example, to get assistance with Medicare Part A, Part B, or Part D, or how to apply for Medicare.
I need
How can I
assistance
help
with Medicaid.
Can you be a little more specific? Please briefly describe
Hey, Medicaid help.
Part A,
SSI.
Part B, or Part D, or how
I
to
am
apply
on
for Medicare.
I am on Social Security. I need help. I need help with transferring.
This is brutal to watch. She's disabled, on SSI, just moved states, needs medication that costs thousands, and she's getting bounced between agencies like a ping pong ball. Call Social Security. Call Medicaid. We can't help you. This is what happens when you gut safety nets. Real people, vulnerable people, fall through the cracks, and they suffer. And for what? So we could cut taxes for people who make more in a day than she'll see in a year? This isn't efficiency. This is cruelty disguised as fiscal responsibility.
Medicaid's in states.
The easiest and most convenient way to apply for benefits or get benefit estimates is by using our online.
Fucking wait time is 40 minutes.
Hey Mainers, as warned, Maine Family Planning is shutting down its primary care services at the end of October, continuing just an awful year for access to healthcare here in Maine. 8,000 Maine patients will lose those services on October 31st, and the big beautiful bill is to blame. Since it can't legally shut down health clinics that perform abortions directly, and funding for abortion is banned by federal law anyway, the Trump administration's strategy has been to choke off funding for the non-abortion services performed by these healthcare facilities. The Republican budget, that's President Trump's big beautiful bill, prevented these health facilities from billing Medicaid. The Press-Herald reports that this means starving Maine Family Planning of 20% of its annual budget, $1.9 million. Quote, "The cruel and dangerous law has put us in an impossible situation. Discharging and turning away vulnerable patients strikes at the very heart of MFP's reputation as a trusted community provider that has been able to serve patients of any means for more than 50 years. That was George Hill, the president and CEO of Maine Family Planning. Planned Parenthood told the Press-Herald that it will use funding reserves to offer primary care services to Medicaid patients at its 4 clinics in Maine for now, while it pursues its own legal challenge. But if that challenge fails, its 7,100 primary care patients may need to find new doctors. This year alone, Northern Light Health has closed Inland Hospital in Waterville, its walk-in clinic in Bangor, and last week it announced it would close the walk-in clinic in Waterville too. 4 other hospitals are reportedly also at risk of closing under financial pressure, including the Aroostook Medical Center, now the Northern Light A.R. Gould Hospital in Presque Isle, Maine Coast Memorial Hospital in Ellsworth, Cary Medical Center in
8,000 patients losing care. A clinic that served the community for 50 years. Gone. Why? Because they provide abortion services, the bill cut off all their Medicaid billing, even for things like cancer screenings, birth control, STI tests. Federal funding for abortion is already banned. But this is about punishing clinics out of existence. It's not about protecting life. It's about controlling access. And it's not just Maine. Hospitals and clinics are closing across rural America. Healthcare deserts are expanding. And the people losing access? Many of them voted for exactly this. You wanted smaller government? Well, here it is. Hope it was worth it. So here's the lesson. You can't dismantle the safety net and act shocked when you fall through it. You can't vote against healthcare subsidies and cry when your insurance becomes unaffordable. Economics doesn't negotiate. The math doesn't care about your politics. And when you make decisions based on slogans instead of facts, eventually, reality sends the bill. These aren't victims of some liberal agenda. They're facing the consequences of their own choices. Yeah, there's irony there. But underneath, just preventable, unnecessary suffering caused by voting against your own interests. So if you're still defending these cuts, still blaming the wrong people, good luck with that premium increase. Drop a comment. Should people get help even when they voted for this? Or is this just consequences? If this cleared things up, hit like, share it, and subscribe. See you next time.